Pregnancy should be a time of joy and not anxiety for the woman and her family. Do you want to learn more about pregnancy or have questions about fertility and reproductive health? Then join Dr. Linda Vanutu on Facebook and YouTube every Saturday at 4 p.m. on the Online Pregnancy School as she discusses pregnancy, delivery, and childcare with us.
Hello, ladies and gentlemen. Once again, it's my pleasure to welcome you to the Online Pregnancy School. I trust you are doing well and also keeping safe. Please remember to keep safe using all the protocols that are available in wherever you are watching us from. We thank God for another time where I'm going to share with you another important topic. For those who have subscribed to my YouTube channel, given us comments, shared with us some questions, we are very grateful. We encourage you to continue joining us and watching, and please share. And on Facebook, follow us, The Pregnancy School. You will learn a lot, which you can share with friends and also use for yourself, especially for those who are yet to become pregnant. This is a very important thing for you to be part of. So please, if you haven't done that, go ahead and hit that subscribe button and also turn on the notification bell. Give us thumbs up, like our page, and remember to share. I want to remind you of the magazine, Promise from the Womb, which you can get on Amazon. So get yourself a copy, learn about pregnancy. Pregnancy should be a time of joy and not anxiety or fear. And remember, we are on a journey of helping to reduce preventable maternal and newborn deaths. Join us. Today, I'm going to share with you another important topic. And it is very important because some people have not been thinking about it. And the topic is depression during pregnancy, a very important topic. Mental health is very important in everybody's life, children and adults. But unfortunately, we don't talk so much about mental health. But it's the basis, because if you don't have a healthy mind, it will be very difficult for you as an individual to interact with your family, with your friends, and the general society. So it's very, very important. And I'm going to take you through some characteristics. We'll look at the risk factors, the signs and symptoms, the effects that depression in pregnancy can bring onto the family, the management, and then we'll end with some take-home messages. So depression is very common in the general public, but it may be subclinical, which means that somebody might be suffering from depression, but people around may not even know because it will not be that visible. However, if you watch that person closely, you find that the person has changed in one thing or the other. Now, there are different types, but thank God, depression can be treated. We can have depression before pregnancy, during pregnancy, or after the baby has been born. But today, I'm going to focus on depression during pregnancy. Maybe in future, we will look at the other aspects. Now, when you look at pregnant women, it's been found that at least 1 in 10 of them will suffer from depression whilst they are pregnant. And the hormones that we've been hearing about are here again. They play a key role. They bring about these mood swings and all the things that happen during pregnancy. We have told you a lot about what happens during the first 3 months, the second 3 months, and the third 3 months of pregnancy. So a lot happens, a lot happens. And for the women, depression, even in the general public, those who are not pregnant, may not be so obvious because of the role that women play. At home, you find that a mother may not eat till she has given food to her children in some societies. And if there's very little left, that is what she will eat. So if anything changes, it may be difficult for the people to recognize that. She gets up in the morning, sometimes she works the whole day. So if she's changed, but she has changed in that respect, somebody may say that this is what has been happening. And then for those who are pregnant, we find that some of the symptoms that occur during pregnancy may also be as a result of depression. For example, tiredness. When you are pregnant, you feel tired sometimes. You don't want to do anything. And even the appetite can also go down. So if this happens and the woman is depressed, but she's pregnant, somebody might think that these are just part of the pregnancy. It is nothing new. But actually, it may be that the woman is depressed. The thing that we all have to understand is that fathers can also be affected by depression. If somebody makes a woman pregnant when he is not prepared, that person can go through depression. We have had a lot of stories where the father of the baby was nowhere to be found when this girl became pregnant. And we don't know what happened. Some of them even take to drinking when they realize that they have made somebody pregnant, or some of them just leave the place. A whole lot of things can happen. So fathers of babies can also become depressed when the woman is pregnant. That is something we have to keep in mind. So what are the risk factors? In the general public, some of these things can lead to depression. Major family events that are stressful. Separation. A couple living together, now they separate. Then the woman realizes that she's pregnant. That could be a big reason why she will be depressed. Relocation and death. Sometimes we hear of women whose husbands die when they are pregnant, and they even have names for such babies. That could be a cause for depression, or not the husband, but somebody else in the family, a close relative, or even a friend or a colleague. Somebody dies. That becomes very stressful for this pregnant woman. She can become depressed. If there's a previous history of depression, let's say this lady has had depression in the past, then it's a risk factor for depression in her pregnancy. If there's a family history of depression where she is not the one who was depressed in the past, but somebody else in the family, then she could be depressed during the pregnancy. If this woman finds that she's carrying twins or triplets or more, that could also be a reason why she becomes depressed. And it's funny, isn't it? Because somebody may be looking for one. Somebody's pregnant with twins and she's depressed for various reasons. So it is not because of the fact that she has and she doesn't want, but a lot of factors can come to play in this particular instance. Now, if a pregnant woman realizes that the pregnancy may not get to term, and term here is 40 weeks plus or minus 2, and if the pregnancy ends before 37 weeks, then it is called preterm. So if for any reason she realizes that I may not be able to go to term, that alone can give her some issues and she can become depressed. If she finds that she has some complications with the pregnancy or the birth will end in cesarean section, some people do not fathom that they would ever go through cesarean section. So if she's told maybe some weeks before that we'll have to deliver this baby through cesarean section, that alone can give her depression. So pregnancy itself may have complications that can end with depression, or the fact that there's a complication with the birth can lead this woman into depression. Now, another big thing that can let a pregnant woman have depression is intimate partner violence. Ladies and gentlemen, there are some men who, for one reason or the other, become so angry with a pregnant woman, a pregnant wife, that they abuse them physically, even some of them to the extent of kicking them in the abdomen, in the tummy. That can be very, very dangerous. I want to entreat the men, please. We know that can be challenging. If you have any issue, please do not take it on the woman. There are a lot of hospitals around. There are a lot of people who have been trained. So please go to the hospital. Share your story with them. Just go get yourself a card, see the doctor, and the doctor will be able to help you. Or if you see any nurse around, talk to that nurse and let them help you, because this can be very dangerous. For some people, it is not just the physical abuse, but emotional. They treat the woman in such a way that she feels like she's not a human being. Or economic. At that time, maybe she's not working or she needs some financial support. That man would determine that I'm not going to support him anyway. That can lead the woman into depression. And then socially, you don't even want to go close to her. That again can lead her into depression. So some of these can happen as standalone, or some of them can be combinations. So we find that there are these risk factors which we all have to be aware of that can happen during pregnancy and let a woman become depressed. Now, the RAM just stands for Risk Assessment and Monitoring. And this is for screening for depression in pregnancy. So as a health worker, as somebody staying with a pregnant woman, these are some of the things that you need to be aware of. If a woman is very young or quite elderly, that could be a reason why she would be depressed. Let's say a 13-year-old, a 12-year-old, a 14-year-old becomes pregnant. That person can become depressed. And I've seen one where the young girl just went mute. She wouldn't talk to anybody. So nobody even knew who made her pregnant till she delivered. She wouldn't talk. She had to go through a lot of counseling till she started talking. And then if somebody who was not really looking for a child is now about 40, 45, 50, some people even above that become pregnant, then they are in trouble because they think that this is not, I'm too grown to have this baby. And for all the reasons why you shouldn't have a child when you are that age, they can become depressed. For some people, it's because of their past reproductive history. So the number of pregnancies they have had, how many they have lost, how many children they have who are still alive, and then if they ever went through fertility treatment. So if you are a midwife and a pregnant woman comes to you and she has been treating infertility for a long time and now she's pregnant, please be on the lookout for this woman, that this is a woman that I have to get close to and make sure that I take good care of her. And then for economics reasons, if she doesn't have the money and now she finds that she's pregnant, that will be a problem. If she is not married and she's pregnant, or the marriage is not really as it should be, she may have depression out of this. And if there's no family support, that could also be a reason why she can become depressed. So as you stay with them, as you see them as midwives or doctors, please be careful that there's the need to take note of some of these things, and then where she comes from and how you see her. Talking to her, you know whether she's emotionally stable or not. And if she's not emotionally stable, then that person has to be monitored very well. So this is a very good thing for midwives, doctors, and people living with those who are pregnant to keep at the back of their minds that if any woman falls within this group of things that I've mentioned here, then I need to be careful. Ladies and gentlemen, if you have just joined us today, I'm talking about depression during pregnancy. And I'm sharing with you some of the things that will let us know that somebody is going through depression. And if you haven't done that yet, please go ahead and hit that subscribe button. And also on Facebook, follow us, like our page, give us thumbs up, The Pregnancy School. The signs and symptoms are as listed here. One of them is poor self-care. So this woman who used to look quite good, now doesn't even care about her hair, her face, her feet, nothing, her dressing, nothing worries her at all. If you see that a woman who is pregnant, who was not like that before, starts exhibiting these symptoms, then please be on the lookout and watch her closely, because she might be going through depression. Others also have this low self-worth. They have feelings of guilt, worthlessness. They don't think that they amount to anything or they are anybody at all. No. They also may have poor eating habits. For this one, they may be eating too little or too much, or they lose appetite altogether. And because when somebody is pregnant and the person is not depressed, can have changes in the eating habits. If you are not careful, you might think that this is just part of pregnancy. So be on the lookout. If somebody was eating normally and then all of a sudden starts eating very little or too much or doesn't eat at all, that is not normal. Or they may be craving unhealthy foods, foods that everybody knows should not be eaten. That is what she wants to eat. And then when you look at her face, she has this sadness on the face all the time. It is persistent. And there's no facial expression. When people are around chatting and talking and smiling and laughing and doing, she will not do any of that. She just sits. Nothing pushes her. And then she may even be saying things to show that she has lost hope, even trust and faith in God. She has just given up. If you have a woman with you who shows any of this, when she was not like this before, even at the beginning of pregnancy, but somewhere along the line, she starts showing these signs, please do not say that this is part of pregnancy. The other thing is that she has poor family engagement. She easily becomes angry or irritable, and even with her friends and colleagues. Let somebody say something that is a little bit off, she will take it on. So that is the kind of thing that will let you know that this woman is not behaving like she used to, and we have to be careful. Then she loses energy completely. She doesn't want to do anything. And she also has poor judgment, and this can affect her concentration. So when you are having a conversation with her, you find that she's just looking somewhere and she's not paying attention. So she can't even tell you what you are talking about. That should show you that there's something wrong here. And then she has these poor sleep habits or patterns. Every pregnant woman needs to sleep well. But this one, she would either sleep too little or she sleeps too much. She just wants to lie down. She doesn't want to do anything. Like I said earlier, lack of desire to do the usual chores. She just doesn't want to do anything. Just let me sleep. Pregnancy is not a time, unless there's something wrong, where you should just lie down and not do anything. That is not the time. And then she also complains of bodily pains that do not go away with treatment. So my head, my waist, my leg, my arm, every time she has pain somewhere. And if she gets treatment, she doesn't even feel that it is gone. Please be careful about that. And unfortunately, some of them have these suicidal thoughts or even attempts. So if you are there, do not let it go to that level. That's why I put it at the bottom. Do not let it go to that level. With all the signs and symptoms we have mentioned, at least you can pick one or two. If you are paying attention to this pregnant woman, for a midwife, this pregnant woman who comes to you every time, you should be watching out for some of these things to know that things are not like the last time when she came. So what are the effects of depression in pregnancy? One of them is the poor nutrition leading to anemia and other things. So if she's not eating well, if she's eating food that is not nutritionally balanced, then she will become anemic. And this is a whole problem because it can lead to a whole lot of things during pregnancy. She will have poor fetal growth because the food is not good. The baby feeds from the mother. So if what is going on into the mother is not good, it will affect the baby. So this baby will be very small for the age that the pregnancy is. And that has its own challenges. We'll talk about that in the future. Then there's also the severe back pain. I told you that they have pains. And the last time when I shared with you low back pain, I spoke about stress. So if stress can give low back pain, then depression can give more of that. So you can have severe back pain. There's also reduced immunity. She's not eating well, she's not sleeping well, her whole body is not in a balance. So her immunity goes down and she can be prone to infections. Then, because of the state that she's in, she will not even want to adhere to treatment. let alone attend the antenatal. So you find that if she's on treatment for, let's say, diabetes or something else, hypertension, which are two very, very, very important complications in pregnancy, she will not adhere to the treatment, which means that whatever these conditions will lead to them. And then she can have poor pregnancy outcomes, including miscarriage, including poor fetal growth, including fetal death, including a whole lot of things which are not good. And for herself, her life is even in danger. And all these things, not eating well and all that, and the state that she's in, can also lead to poor brain development in the baby. And when she delivers, she will have poor attachment to the baby. She will not bond so well with this baby. Her breastfeeding will be poor. And then she will not have any love for this child, especially if she went through this partner violence. So wherever we have partner violence taking place, it affects the growth of the baby whilst the baby is still inside the mother's womb, to the extent that when this child is born, the child will show these emotional issues into his future, not just at the time of birth, but into the future. So it is very important, please, the men, please, if you have any challenges with a pregnant woman, remember that the child can hear, the child can feel, the emotions that the mother goes through, her mood, all those things affect this child when the baby is still inside the mother's womb. We have had a session on that. So if you go back into our YouTube, you find that there is a session where we looked at the mental state and the effect on the baby. We have also had a session looking at the mental state and the effect on the mother as well. So it is very, very, very important that we treat pregnant women well. Ladies and gentlemen, if you have just joined me, today I am talking about depression during pregnancy, a very important topic. We don't talk so much about it, but the effects are enormous. So please sign up so that you don't miss any sessions that we bring your way. So for the management, we can have the home support. I have shared with you some of the signs and symptoms. So if we'll be able to help pregnant women to stay healthy, then if you are staying with a pregnant woman, please be supportive. Take interest in her. If you are the husband, if you are the sister, the mother, anyone staying with a pregnant woman, irrespective of the person's age, irrespective of whether this woman has had children before or not, this pregnancy can be the one that will tip her into depression. So the home support is very important. We also have counseling, and we have people who have been trained as clinical psychologists, psychiatrists, counselors, the health providers. They can help you. So if you're a pregnant woman listening to me, or you know a pregnant woman who has shown one or two of whatever I have shared with you about the signs and symptoms, please do not let this woman stay by herself. Help her to go for counseling. When she goes to the hospital, there are medications that are given to help such people. And please remember that when you are pregnant, the first 3 months are very important. So it is not every medicine that you can take. That's why it's important to go to the hospital for the treatment to be given, so you do not take anything that will affect the growth and development of this baby. So medications are also used, and there are medications that can be given for depressed people to take. Then there's also the follow-up. So once it's been diagnosed that this woman has depression during pregnancy, she will not just be left at the end of the treatment. No, she'll be followed up, because some of the women who develop depression during pregnancy go on to develop depression even after they have delivered. So it's important that she's followed up, and whatever support is given so that she doesn't continue to be depressed into the postpartum period, because that is a very, very, very important time in a woman's life when she has delivered, and a lot can happen. That's why the support will go to the postpartum period after she has delivered. I hope it is clear. This is a very important topic, and if we are with pregnant women, we can help them to go through pregnancy successfully. So this will be my take-home messages for you. Having known about the people who can have depression, the fact that 1 in 10 women who are pregnant may come down with depression during pregnancy, it is good. You never know whether it is the one person you know, that one person you know or not. So please, wherever you are, just support that one pregnant woman that you know, so that she doesn't become the 1 out of 10 who will have depression. So support pregnant women, and please lend a helping hand when you see that they are overwhelmed. Some of them are just overwhelmed with so much to do, especially if they have little children or they have other people that they are caring for. It can be very overwhelming. So a pregnant woman is taking care of her little children, taking care of the family, doing her own work, and so many things. So please, if you are there with them at home, help them to go through. And then also support them to seek medical care when you notice any changes. I have listed so many things that can happen. So it is important that you check that these pregnant women are not having any of the things that I have mentioned. If you find any of them having even one, where you find that this woman was not like this, now she has changed, please don't stay at home. Help her to see the doctor. It is very, very important. Ladies and gentlemen, I hope you have enjoyed today's session. It is a very important topic, depression, even for you as an individual. You may be there, you may not be a woman, you may be even a young person, you may be a man, but you find that you have some of the things that I mentioned. Please, that is the time for you to go to the hospital. You may be depressed. You don't have to stay with it. There is help out there for you. So get to the hospital and let someone see you and help you. If there's counseling, you'll be taken through counseling. If it is treatment that has to be given, it will be given to you. Do not stay with your challenges weighing you down to the extent that you become depressed, because that will affect you as an individual and also affect the people that you are living with. I hope you have enjoyed the session today. If you have any question, please send me a WhatsApp message, +233 59 242 0625. Please WhatsApp message. Well, I'll see you in my next video. Bye.
Pregnancy should be a time of joy and not anxiety for the woman and her family. Do you want to learn more about pregnancy or have questions about fertility and reproductive health? Then join Dr. Linda Van Otu on Facebook and YouTube every Saturday at 4 p.m. on the online pregnancy school as she discusses pregnancy, delivery, and childcare with experts.